This is how to administer a subcutaneous injection. I will begin by checking my PCP orders and gathering my supplies. To administer this injection, I need gloves, patient labels. Today I will be administering insulin, so I will need an insulin syringe. I will need my vial of insulin, alcohol preps, a trash container, and a sharps container. I will begin by drawing up my medication. Today I will be giving NPH insulin. NPH insulin has a precipitate in it and must be rolled to reconstitute the medication before withdrawing it out of the syringe. I will gently roll it between my hands to reconstitute the medication. I should not shake the vial to reconstitute the medication. Also note that insulin has an expiration date on it and the date that the vial was opened, as insulin is only good from 30 days from the date it was opened. I will want to, at this point, remove the wrapper from my syringe. And discard. This particular syringe has a safety feature, a wing on the side, and I can remove it, set it to the side. I'm going to begin by cleansing my vial with an alcohol prep. Today I will be giving 10 units of insulin. I'm going to begin by removing the cap, withdrawing 8 units of air, or 10 units of air, I'm sorry. I will inject the air into my vial, then invert my vial and withdraw my insulin. At this point, I will passively recap by scooping the cap and replacing. The next thing that I'm going to do is label my medication. I need a patient label, and on the label I will write the medication, the route, and the amount. I will place this label on the syringe itself. At this point, I'm going to go into my patient's room. I need my gloves, my alcohol preps, and my medication. I will enter the room, wash my hands, introduce myself to my patient. I want to identify my patient by asking them to state their name and date of birth as I am looking at their identification bracelet. I also want to ask my patient if they have any allergies. I will put my gloves on and cleanse the skin. Today's injection is going to be given in the abdomen. Because I am demonstrating insulin today, it is important for me to note what my patient's blood glucose level is. I will be cleansing the skin with an alcohol prep. It is important to do a skin assessment and make sure that there is no scarring, wound, infection, bruising, anything out of the ordinary at the skin site. There are 2 different ways to give a subcutaneous injection. If you are able to pinch 1 inch of tissue, the angle of injection will be 45 degrees. If you are able to pinch 2 inches of tissue, the angle of injection will be 90 degrees. This is the preferred angle of injection as it will decrease the likelihood of a needle stick injury. I will remove my cap and discard in the trash. I'm going to dart the needle quickly as it will decrease pain to the patient. I'm injecting the medication, then releasing. I will engage the safety device and dispose in the sharps container.